Welcome to the second module of the Couple and Family Religion and Spirituality Competency Training Family Course. In this module, we will review 4 great ideas from the research literature on spirituality and families. These are the 4 aspects of research that have been fairly well studied at this point, and they are 1. Religious coping in a family, 2. Sanctification in a family, 3 is forgiveness and humility, and the 4th one is prayer research. Now, at first look, they all may seem positive, but there are ethical and clinical practice issues we should all be aware of. We can help remember these 4 elements through a little mnemonic. Can someone find peace? The C in can stands for coping. The S in someone stands for sanctification. The F in find stands for forgiveness, and the P in peace stands for prayer. Can someone find peace? Before we begin any intervention or treatment with a family, we always want to know what research supports our work. And the good news is that there is a substantial research base on spirituality and families to guide our work. We want to give you an overview of that research.
You likely know the religion and health research that demonstrates that RS predicts better general health and longer life. There are hundreds of medical and mental health studies that support that statement. This is true even after controlling effects such as religious people smoke less, they drink less, use drugs less, and get in fewer bar fights. They have fewer fatal road accidents and have larger interpersonal support networks. And they engage in more health-promoting behaviors. Something about religious beliefs, values, and practices other than changed health-related behaviors affects longevity and health for many religious people. But not all religious people. There are ways in which spirituality or religion can cause harm to people. For example, intensifying harmful stress reactions if one has a religious conflict within or outside of their religious organization. Or harmful or risky religious practices such as snake handling or the refusal to seek medical attention. But it's been well established that most religious people, most of the time, are enriched and healthier because of spirituality or religion. No major religion appears to be better for people than another, and the research is digging into the factors that seem to be causing this correlation.
Similarly, people who engage in religious or spiritual practices on the average also tend to have healthier couple and family dynamics, tend to be happier, and have better parenting and child behavior. Again, we can all think of cases where there were toxic or unhealthy spiritual factors in a family that harmed people. Yet for most religious or spiritual people, most of the time, engaging in spiritual striving, practices, and a spiritual community promotes healthy family.
Why does spirituality and religion tend to predict healthier family? Most research on religion tends to be correlational in design. After all, researchers cannot randomly assign people to religion and see what happens. And we know the basic rule of research: correlation is not causation. So it's possible that some factor other than the religion or spiritual factor is contributing to family health. But direct research on spirituality has given us some clues.
Most families have a religious history and their current practice. People tend to engage in faith as a family together. Each religion then provides rituals and models for weddings, sexuality, the birth of children, parenthood, and funerals. These experiences increase a family's bond and reduce chaos for most families.
Annette Mahoney from Bowling Green State University conducts research investigating how families might see marriage and parenting as spiritually significant. Her team borrowed the religious term sanctification, which is the manifestation of God or a higher power treating something as holy and or imbued with sacred quality. All religions have holy or sanctified purposes and objects, which includes families, as holy or sanctified. A meta-analysis published in 2021 reviewed 49 articles and 14 dissertations that have studied sanctification. People with higher levels of sanctification tended to have better psychosocial adjustment and less negative functioning. One experiment by Frank Frencham at Florida State found sanctification predicted lower infidelity in relationships. Two other studies by Catherine Kushner and Emily Paget, both at Bowling Green, found sanctification of marriage predicted positive couple communication during observed interaction.
But sanctifying aspects of marriage or family are not always positive. Sanctification can also cause family members to perceive offenses as a desecration of the sacred, which magnifies the impact of major offenses. They may see a major transgression as an offense against their holy union or their holy family, or an offense against God's plans for their lives. They may need special attention and therapy beyond mere cognitive interventions due to the deeply held emotional commitments associated with sanctification. Research has indicated that sanctification of marriage can also cause partners to spiritually triangulate. Now, systems theory teaches that negative triangulation can be used by members in a family dyad to attempt to get a third person or entity to take their side, which increases their power. You may have seen teenagers try to get one parent on their side to get what they want. That's triangulation. People can also try to frame issues so that God appears to be on their side. Divine triangulation might be loosely defined as attempting to ally with the divine or to imply that such an alliance exists. Divine triangulation can be positive, such as people joining with a higher power by praying for a blessing on one's children or one's spouse. It can also be negative, such as manipulating sacred writings so to place God on your side against a spouse. For instance, the Bible says you are to love me and I don't feel loved. Or maybe blaming one's children for bringing down the family honor. What is sacred or holy and how it is described can vary, of course, by religion, locality, and traditions. And for those who practice new religions or their own individual spirituality, there may be sacred concepts that are unique to that individual or family. But in each religion, these holy objects, roles, and responsibilities can lead family members to triangulate their divine on their side and against a family member.
Perhaps the largest collection of research in existence relevant to religion is the research on forgiveness. All major religions have encouraged their followers to engage in forgiveness as an answer to the problem of offenses in relationship. Is forgiveness healthy? Overall, yes. Forgiveness has been related to relational health, mental health and well-being, spiritual health, and even physical health. Researchers like Ev Worthington at Virginia Commonwealth University have conducted hundreds of studies and found forgiveness in close relationships and intimate partnerships to restore relationship health and happiness. Other religious ideas common across religions like humility, gratitude, and loving kindness have also had strong research support. Findings are now also used in mental health care interventions, producing positive results in most situations. This overlap of religion and mental health care gives us an opportunity to engage both the spiritual and the psychological in psychotherapy.
Consider the case of Michael and Cricket, who are married. Michael is the pastor of a Baptist church. Cricket has caught him using pornography, which they both agree is incongruent with their religious values. Cricket is deeply upset by this and consults with another local Baptist pastor, who gets Michael in some trouble with the local group of ministers. He is put on probation by his church community for pornography use. Cricket is having nightmares, is overwhelmed with anxiety, and can't sleep. She says she prays constantly for Michael and asks that God will fix his addiction to porn. Michael agrees this is a moral problem for him, but Cricket thinks it's a psychological problem too. She brings them to counseling. The counselor doesn't see other problems in Michael's life other than this conflict affecting his work at the church and their marriage. In fact, Cricket seems desperate for the counselor to diagnose Michael as spiritually immoral and an addict. She wants the counselor to guide the couple through prayer and forgiveness as part of their counseling.
Let's apply the research on religion and spirituality to Michael and Cricket. What appears to be pressing Cricket is anxiety. Her sacred marriage has been desecrated. She feels a loss of control. She uses others to get some control back. She is triangulating God, another pastor, and the counselor to be on her side to, quote, fix her husband, end quote. Through an unhealthy triangulation, she seeks to persuade others to convince Michael that he has an addiction. Her anxiety would likely be resolved if she held the power position in the family.
Well, let's not pathologize Cricket, though. She is in deep pain and is full of confusion. It can appear that spirituality has created a hopeless situation where the partner's ideas are incompatible and the couple relationship is doomed. But the research says that spiritual resources can be helpful to therapy. So, using spiritual resources such as positive prayer to manage her anxiety, humility, that she is also a human who is sinful, to use her religious language, and engagement in a compassionate type of emotional forgiveness, she could foster harmony and love in their family.
Michael has also things to explore. How he is drawn to pornography despite its incongruence with his own religious values. Why is he unable to use his intimate partner to address his emotional needs? Is he feeling lonely, isolated, and under pressure in his work and family life? He might feel estranged from his God, which is especially difficult as the spiritual leader to admit. Spiritual leaders are often quite isolated as they have special roles within the religious community and make expressing vulnerability to those with whom they have the most daily direct contact. Spiritual incongruence is a place for non-judgment, exploration, and reflection with these clients.
Frank Fincham and Stephen Beach have conducted studies that show that positive prayer increases couple commitment and forgiveness. Importantly, that prayer should be both positive and supportive. Prayer that blames the partner or treats the partner as something needing a divine fix are hurtful and not helpful. Brigham Young University researcher Joel Chaudhry has also demonstrated that family prayers increase bonds and reduce tensions in families. There is research support for Cricket and Michael to use prayer if they use it positively and not as a spiritual weapon to coerce the other person to give up sinful pornography and admit to wrongdoing and beg forgiveness, or to give up her crusade to make me over in her image of what I should be like.
If you want to engage a couple like Michael and Cricket, or any religious client in a relationship or family, in using positive prayer, how might you do it in an ethical way? You might consider individual prayer journaling, like other types of journaling. Each partner can write out their prayers to their higher power. Offer prompts that engage positive triangulation, i.e., ask the partner, how would you like me to pray for you? Might be helpful right here. These can be private or they can be shared. If the clients have common spiritual tradition and pray together regularly, you can ask them to write out a prayer of blessing together as an act of spiritual surrender to their higher power. Many religious traditions have proscribed prayers that are said when there is need for forgiveness or humility, which might be appropriate for this case. They can ask their religious leader or seek out written prayers and use them in their daily practice. Consider the prayer and its purpose. This is an important factor when prescribing prayer as a therapeutic intervention. Prayer can be a mutual exercise in humility, can be other-oriented, or encourage exploration and change. Prayer can be the opening of self to God to increase vulnerability. But prayer can be used poorly as a wish list and in I want this and I want you to take away that and etc. It is most useful when you encourage clients to become students of prayer within their faith tradition, to talk to their religious leader, to read on the topic within their tradition.
But let them know that the prayer can be used as a point of discussion in your treatment to watch for whether the prayers are bringing them closer together in their love and bond or driving a wedge between them. While you won't have spiritual direction for them in most cases, because you're a therapist and not a spiritual official, you do generally have the therapeutic goal of increasing their positive bond as a family. You can explain that prayers can become a spiritual triangle, either for or against one's partner and family. Blessings are for the partner, but prayers can also be used against the family, can fuel rumination, complaint, and grumbling. For instance, prayers of gratitude and blessing can be one antidote to negative triangulation. Finally, most clients state that they engage in prayer often, but after exploring their practice, you might find that they don't actually pray very much at all, except maybe ritual prayers like prior to meals. In this case, you would want to keep any prayer plans, work, and therapy simple and at the spiritual level of the client. Unless you are trained and explicitly engaging in spiritually directive work, you want to be careful not to direct clients towards spiritual practices that they don't already use. Instead, you have them use the natural spiritual practices they already use in positive ways to help with their current problems.
And of course, you should always work within the spirituality or religion of the client and not persuade them towards your own practices or experiences. If you have spiritual practices you enjoy, that doesn't mean they will match up with the client. And if you don't engage in spiritual practices, one shouldn't ignore or discourage the engagement of spirituality based on your bias or your experiences. You might find it helpful to explore this to increase self-awareness of how this might occur. This is an ethical boundary of autonomy to respect. Let's review. In the first module, we talked about self-exploration of one's own spirituality or religion, and 4 great ideas to emerge from the literature on family systems theory. These included maintaining a non-anxious presence, ego differentiation, multi-directed partiality, and exclusion and embrace. You will see how those ideas come back as we work through other aspects of building your spiritual competence.
In this second module, we identified 4 great ideas that have come from the literature on religion and spirituality in couple and family psychology. They were religious coping, sanctification, forgiveness and humility, and prayer. And we use the mnemonic, "Can someone find peace?" to help us remember this module. At first look, these 4 ideas all seem positive, but they each can be at times positive or negative. And as a therapist, you need to keep attending to how they are being used by the couples and the families.